What's the difference between a psychiatrist and a psychologist? This is a question that a lot of people have. And today I'm joined by Lara and Manuela to discuss what each of them do and how they can work together in the best interest of their clients. Welcome, Manuela and Lara. Thank you for joining me here today.
Thank you for having us.
Yes, hi Sarah, thank you for having us.
So you are both with us at Thrive. Lara, you're working as a psychiatrist, and Manuela as a psychologist. So two different but complementary fields. Can you walk us through what it is that you do as part of your job? And maybe later we can talk about some misunderstandings or myths that we want to correct for our viewers.
Okay, so I will start. So me as a psychiatrist, what we do, we are medical doctors and we specialize in mental health. So I know there are many misunderstandings about psychiatrists. They don't listen, they just prescribe. But what we do is we assess the person, we can diagnose, we prescribe medication when it's necessary, and we also refer to the psychotherapist. But there are some times, for example, if a client is very anxious or has been suffering from panic attacks, of course, they need some medication to feel calmer or to stabilize the symptoms. Right, Manuela?
And recently, Dr. Lara, she sent me a patient that was quite in distress with a major anxiety. So she stabilized him first with the medications. After that, we were able to work a lot on, himself, his past history, and he was able to retrieve a major trauma.
Okay.
So with this, he processed the trauma, and because it came for the panic attacks disappeared, anxiety was lower. So what do? As psychologists? We are creating a safe space. That's the main thing. In this safe space, we're building a relationship based on trust. And I think this is one of the main tools that we have. Other all the technical tools, the relationship is a genuine relationship, a genuine sense of care of the patient. And this is part of the healing process.
Yes.
So recreating an atmosphere, a space where they learn not to be judgmental towards themselves. I usually battle with the judge that is ready to, with the wig and the hammer, and definitely review things. One of the most common sentences that I hear is, "Oh, I never thought about it that way."
Wow.
So a different perspective for a new beginning. And what we're doing, we're breaking the emotional isolation, because you can be with people and feeling really alone.
So what you've shared with me, if I can just summarize for our audience, is psychiatrist, medical doctor. People have this idea that it's going to be this very rigid, very kind of cold experience, which it is not. And what you can do is you can assess, you can diagnose, you can prescribe medication when it's indicated for that person's condition. Sometimes that might be a good first step to stabilize that person before referring them to psychotherapy. And then with psychotherapy, what happens is your main task is to establish a warm, trusting, supportive relationship, a nice environment to be able to peel back different layers, identify the historical contributions to whatever the presenting problems that the client has. Fair?
Yes, exactly.
Okay. So then once you have a shared client, how does that work? How do you kind of coordinate that person's care towards whatever their treatment goal is?
So it depends. If the patient is coming, has been referred from the psychiatrist, which is one very important thing, because often the psychiatrist is the first point of contact. It's easy to go and say, I need some anxiety medication, and that's it. But the psychiatrist is able to build a relationship. And this is crucial when there is a referral. So you should do some therapy, maybe you can try. So it opens a door. And then I always say we look like a sort of a parental couple, where there is mom and dad, that are creating together a solid base. It takes more effort because we share notes, we talk, we discuss, we give us updates. So it's much more time, but it's so important and it's so beneficial for the patient that they feel it. They feel they have a team, a small team, but they feel it. They feel that there are people they care. And I had a feedback now that comes to my mind from a client. She was adamant, no psychiatrist, no medications, nothing. And I said, you can just try. You know, I think you will be happy. And there's nothing you have to do, no decision you have to make, nothing you have to do that you don't want to do.
Exactly.
The feedback was, I felt heard. I felt I was not a number. I felt the doctor cared.
So this is really interesting because what I'm gathering from the two of you is that the referrals can be bi-directional. So you might have someone come in, Lara, and you might refer them for psychotherapy, whether you kind of get their symptoms under control or not, whatever's indicated in your evaluation process. And the inverse is true as well. You might have a client, maybe it's somebody that's new, maybe it's someone established, and for one reason or another think that a psychiatric intervention is required. So when you make those referrals across discipline, walk me through some of the resistance or hesitation that you face from clients.
Yeah, so for example, there are like 3 or 4 kind of patients that have like their own views. But yeah, many times I have to say that my clients, sometimes they don't want to see a psychotherapist because, you know, it takes time. It's a very long process. And many people, they just want quick solutions, right? They want to feel good like right away. So this is one of the cases. Other cases, I just refer to the psychotherapy and I explain more or less how the process works and everything. And that, of course, it can be difficult because, you know, like talking about traumas or very stressful situations is not easy, but some of them, they trust in the process and they go ahead. And also I have those cases that or either haven't had a good experience with previous psychotherapists or they think it's just a chemical imbalance and that's it. Like, I don't need anything else. I just need medication. So here psychoeducation is very important. Yeah.
So you see a few different barriers. One of them is it's just a chemical thing. And so if I'm going to be on medication, that's going to take care of it. Another one is I don't want to work on a deeper level. So I just will have the medication and we'll have that quick fix. And then the other one is that, you know, I'm coming to you because of things that have been really difficult. It was hard enough to get here. And for me to have to talk about it again and continue to peel back is really challenging. And so that leads me to a follow-up question that many clients do have, which is, do you have to start from scratch? If you have that client that you're able to persuade that, okay, you're experiencing this, we're going to get things under control medication-wise. However, you would benefit from psychotherapy. Do they have to start from zero?
So when I try to explain this to this kind of clients, I start from not from scratch, but from the surface, right? I always say that these symptoms are like the tip of the iceberg, right? That we need to go underneath the water and understand what is happening. Because, yeah, medication can make you feel better, but this is a sign, you know, like, hey, something is happening that we are not addressing or we are not paying attention and we need to process, accept, and it doesn't mean that they have to go right away and start from scratch. Maybe, I don't know, coping mechanisms or meditation or any other kind of coping skills that maybe they feel, oh, okay, I'm starting to feel a little bit better. I'm talking in a safe space. I feel okay just because they are listening to me and I feel they care about me. And then, yeah, it's a long process. But it's very powerful.
What kind of barriers do you face when you want to refer a client to psychiatry?
Two major groups. Never tried, already tried.
Okay.
So never tried, that's psychoeducation. And usually I use a lot of metaphors. And I say, medications can be like a cast on a broken bone. So we need the support to be able to heal. And it doesn't have to be forever. So it's just a temporary solution. Sometimes I do drawings. Okay, this is depression. So see the way it works. When there is, and this is the case of the example I brought before, because the lady was very upset about a previous experience where she felt she was treated like a number. And here is, to the connection. That's why to know, I'm not just referring you. I know that you're going to be in safe hands. And this is very important. So all this, like with the therapy, the two major blocks of resistance that I found usually is what I will learn about myself. I will know that what I fear is true, that I'm not good enough, that my sense of guilt is deeply rooted because, yes, I'm guilty. Or the fear of... you're going to talk about my parents, right? You're going to dismantle all my dreams, right? And I'm thinking about a case where a gentleman came, a father, with tears in his eyes, because he said, I recently divorced. I'm good with the divorce, but I went home to visit my daughter, 5 years old. And she usually, she would used to leave toys all around the house, and you walk and step into a Barbie or something else. He came and it was pristine. He was always mourning, toys have to be in the playroom. It was pristine. It was such a good girl. You did such a good job. She looked at him and she said, now, can you come back home? So he was devastated, right? Because it was like all the times that I was arguing and fighting with my wife, she thought it was her fault, something so bigger than her. And the children, they think they have to fix it. I did it and now I have to fix it. They feel they're not good enough, they feel overwhelmed, they feel guilty. And it's easy for a parent in perfect good faith to brush it off and say, Daddy cannot come back home, Daddy has a new place, you're gonna visit, I'm gonna buy good things for you. So he spotted it. He saw what was going on and he was able to intervene. But this is, one possibility. There are millions of possibilities. And it's just the idea that we formed about ourselves. So with a different perspective, we can realize that at the end of the day, it was a major misunderstanding. So we can understand better your parents, love them more, and love more ourselves.
That is such a powerful example. And what really stands out to me is that the client that you're describing has some deep level of insight and awareness to be able to pick up on that. As you were saying, Manuela, it's something that could have easily been sort of brushed over. And that muscle is something that's really developed in psychotherapy. And it relates to what you were saying, Lara, about the tip of the iceberg. You might have something that's, visible, but underneath it's much bigger and much more deeply rooted, and we need to unpack. At the same time, what a lot of people struggle with, and you were saying this earlier, Lara, is this idea of, well, I'm going to go. They have that old kind of mentality of, I'm going to go lie on a couch. I'm going to have someone sitting behind me and I'm going to meet them like 3-4 times a week. And basically the conclusion is going to be your mother was awful, or blaming the parents somehow. And I don't need to do that. I don't need to go and blame and talk about all of these historical issues when I'm coming to you with a problem in real time. What do you say to someone that has that perspective? There's so many misunderstandings of therapy in what I just shared with you.
So For me, I give them an example. Think about a child. Bedtime, nice and cozy in the bed. Mommy just stopped by for the goodnight kiss. And a car passing by is lightening the room. So with the corner of my eye, I see a shadow and I think, oh my God, it's the monster. He's here. I can almost hear him breathing. And I'm so terrified, I cannot even move my finger to switch my lamp. But if I could, that was the shadow of my favorite teddy bear on the shelf. So the therapist is the one that is helping you switching the lamp, and the light is the therapy. What we think is a major fear, at the end of the day, it is not. So this is, in just one example, how I usually describe therapy to all the clients that have I don't know what to do. I'm here. It's the first time and I don't know what to expect.
What would you say, Lara, to someone that has that resistance?
So I always give the example of the iceberg. And sometimes they are so resistant that they don't go. Nevertheless, I try to explain with metaphors or other kind of examples. They are convinced that they already know it's because of their parents and they don't see any other solution. But I try to, a few times to explain and convince, but sometimes it's not easy.
No, and at the end of the day, if someone begins a process before they're ready, it's not always going to be an effective one. And then that can kind of put them in the camp that you were describing of, I tried and it didn't work. So educating and removing that kind of misinformation is one way to help prepare them. But ultimately, people have to be ready to at least explore. And sometimes that can be a helpful lead in, that just because, like you were saying, just because I'm referring you to a psychiatrist, maybe medication is indicated now, doesn't mean that you're going to be taking that medication forever. Doesn't mean that someone is going to pin you down and make you take that medication if you decide that you don't want to for whatever reason. So just getting them ready and getting them to have an understanding of what it looks like, and that knowing that they have some sense of agency in that process, I think is key. But in terms of the repeating things, what our clients don't always know is that there is that communication between the clinicians with their consent. And we've certainly had the case where it's like, okay, I'm working with a psychiatrist and a psychologist. I don't want them to talk to each other. I want to be able to start from the beginning. I want to share my narrative and so on and so forth. But the vast majority of clients, they want that collaborative work. So regardless of who they start with, you can hand over and say, I met with this client. They're, this is their age. This is their presenting problem. These are their therapeutic goals. Here are some things that are helpful for you to know. But still, the client will have to, at some point in time, repeat some information, right? You can't do a full handover and not have any repeated questions, because you're looking at it through your lens as either a psychiatrist or a psychologist, and you're going to think about different angles that you want to explore. Right?
Yes, actually, a few months ago, I had a client who saw a psychologist before me, and the client was saying, I don't want to see the psychiatrist before seeing the psychiatrist, the psychologist needs to talk with the psychiatrist because I don't want to repeat everything. So when the client came to me, I said, I know a little bit about the story, but I need to ask you a few questions. But he knew I knew many things because my questions were already focused on some...
They're building.
Exactly.
Yeah.
And the patient was so comfortable. So yeah, I think sharing information and it's very important for them.
Yeah, and sometimes it helps us also with the diagnosis because it can be difficult. We can have symptoms that are presenting very strongly. We think about anxiety, depression, and we can have doubts like what's underneath. So it's not always easy in a couple of sessions to establish this. So also because you need the connection, you need to talk, you need information. And sometimes this is the way to, especially communicating, to say, look, maybe things are different. Example, couples therapy, the husband is coming, my wife is a narcissist. She, even when she plays with the kids, she's absent. My needs, to say that my needs are not met is a euphemism. My needs, they are invisible. They don't exist. If I talk, she is, I see that she's looking at me. She's somewhere else. She doesn't care. So what was this sense of lack of care? To me, sounded like being overwhelmed, being sensory overloaded. So what I suspected neurodivergence, and I referred the wife to Lara.
Yes. So we speed up the process also for them. Yes, and also I remember the case that you see the clinical picture and it seems depression, anxiety, and then when I referred to her, she also was, observing some ADHD symptoms. So the client was overwhelmed, developing panic attacks, very high anxiety levels, and at some point they get exhausted about this anxiety and distress condition, and they develop depression. So it's very important. Yes.
Right, because in these two examples, the client that at the end had ADHD, he was building a biased opinion about himself. While in the couple, the husband was feeling rejected, basically. He was not. So it helped the couples therapy. It helped the wife realizing on the vertical side, like, oh, I had no idea this was my situation. So with the psychoeducation, with the awareness, it was a win-win situation for all the family, basically. And of course, this is for us such a big reward.
It sounds like there's a combination of zooming in and zooming out. Like, I'm working with you as a couple in this space. I detect this. There's a hint of that. I'm going to drill down into it. I'm going to give that feedback to you, Lara. You can evaluate in your own way. You will gather different insights and then just kind of ping-ponging back and forth until you figure out what exactly is going on. And it sounds like once that happened, there was clarity and an opportunity to work towards the individual and couples level goals. So that's awesome. And do you guys debate sometimes? Like, I think it's this, I think it's that. How does that look?
Yes, which is also very stimulating, right? Like, of course, the goal is to individualize the treatment for our clients and help them to feel much better, but also between us is very...
Yeah, this is the diagnostic process. Like even when it's about, I don't know, do you think that this is the situation? Yeah, but look at this. Oh, by the way, I have another information. I have another piece of the puzzle.
Yes, exactly.
Right?
Yes. Yeah, because, for example, the client with the psychiatrist, maybe we see each other once a month or every 2 months. With psychotherapists, it's different. Maybe every week, every 2 weeks. So they get to know the daily functioning of the person. Sometimes we don't. So that's why that other part of the puzzle is important.
You have access to different and complementary sets of information, and you can update each other and evolve the diagnosis and tailor the treatment, whether it's the medication or it's the psychotherapy.
Yes,
Okay.
exactly. Also, like if the patient is taking medication, like if, I don't know, maybe someday comes to you, oh, I have a little bit of headache or stomach pain. Is this normal? So we communicate between us and then you do the follow-up.
Yeah, exactly. And this, as I was saying, this is really something that the patient feels. They feel like, I have someone that is really taking care of me. So it's the solid base in a nutshell.
Yeah, it's that, and you were saying it's kind of like a co-parenting, it's a wraparound care. I see this, I see that, together we're able to support you in this way, and we work together. We might not always agree at the beginning what the diagnosis might be or what the treatment plan is, but we kind of navigate building the clinical picture and then working in the best interest of our client. So one of the areas that I know both of you are interested and experienced in is working with people that have ADHD. Why don't you walk me through what that looks like? And Manuela, I know for you specifically, you are interested and have a lot of experience with people that maybe don't have that diagnosis or got that late diagnosis. So these are people who maybe they're adults, like the male client you were talking about, and expressing certain things, and then you get this idea that maybe this is what's going on. How do you work with Lara to diagnose and to kind of treat?
So the first thing that I do, I in my notes is always investigate ND.
Okay.
So I need to ask questions, and sometimes it gets almost silly because they're in the middle of something. And I'm like, "Are you a picky eater?" And they look at me like, "What are you talking about?" But then, there is a big set of questions. And when in my mind is like, I see that this issue, the first thing that I do is the psychoeducation. To the point that once I had a patient, an adult, very successful, he came. And it was like, my life is perfect. The only thing is the social aspect.
Okay.
I struggle a little bit. I feel I don't fit. I don't know why. And in my mind, it was, this is an high-functioning autistic person, brilliant mind. So I explained to him what is neurodivergence, the superpowers, all the beauty of it. And I said, you can be assessed. There's no problem. Maybe next time, because the hour was gone, we can talk about it. He came the session after and he said, I'm not going to be assessed. I like it. What if it would come that I'm not? I want to be. So
Interesting.
I'm good. Because he said, everything makes sense now. But normally, what I do, I refer to Lara, and I'm like, we need to have an answer. We need to know, because what I think it could be needs to be verified, which is we always have to have that little bit of doubt about ourselves to avoid the bias. So let's check. And that's why, for me, to work with the psychiatrist is precious. So I have, a feedback, the honest feedback. And then I refer to her.
Yes, and then the client arrives. I have a little bit of background, and I focus my interview on the ASD or ADHD, yes. And therefore, if they agree, we refer them to a detailed psycho assessment. Yes.
But now I'm curious, tell us about the picky eating. Why is that something that you screen for? Because I imagine some people listening are like, okay, but what does that have to do with anything?
Because this is one of the sensory issues. So the fabrics, the labels of the t-shirts, tight clothes. And I also explained that neurodivergence is like a chameleon. So it's taking the colors of the person. We don't have to tick a box. That's why the diagnosis can be quite challenging, because we're okay, I need to this yes, this no. We need to open our mind. Because neurodivergence is this. It's a very broad concept. So I start with the sensory things and maybe the hyperactivity, which doesn't have to be necessarily physical, can be in the brain. And one of our patients, one day he came because he started medications, and he came, he was like, you cannot believe what happened to me. I was at the traffic light. I stopped. I was in the car with the music. It was just me and the music with no background noise in my mind. It was like, wow, this was... And this, for example, is the impact of the medication. That have to be, I always say, it's something that needs to be tailored on you. Every person can be great, can thrive with a certain medication, not with another, and a certain dosage not another. That's why the psychiatrist is crucial.
And so in terms of that process, so when someone becomes diagnosed with ADHD, for example, how do you manage collaboratively the medication? Because obviously that's going to be your primary role, Lara, but if there are going to be side effects, those are side effects that are probably going to trickle into the therapeutic work. So how do we navigate that?
So for me, I check every time, especially at the beginning, and I report to her and say, look, this and that. So she is the big computer that can elaborate, and understand. I'm just collecting data, but because as she said, I can see the client
more regularly.
Usually once a week. So I can say, okay, how's going? And my first question is, how's going? Especially with the medications, how's going? How do you feel?
Yes, and also sometimes initially the medication will give you some side effects that then after a few weeks they wear off. So yeah, it depends. I always do like the psychoeducation about the medication. I explain everything if they have questions. Sometimes I give my email, so if they have any like important question, they can always reach me on the email. But yeah, this is, and then if the side effects do not subside, we have to change the medication. I always explain it's like a trial. We need to do some trials until we find the medication that will make them feel better.
There is a consequence, very positive, when you do the trial, because they are like, I realize that I'm listening to myself much more.
Okay.
So, and I would say, be an observer. You may learn nice things about yourself. And they like, yeah, because, I was paying attention to myself to check the medication. It's strange. I pay attention to myself. It's great.
Yes, and also I always explain the trial, because sometimes people have very high expectations about medication. So we also need to, bring them back to earth, and we are going to try. Yes.
Yeah, and it can be an iterative approach, but every step or everything that you try is getting closer to figuring out what's going to work for you.
Yes, exactly.
You said something really interesting that stuck with me, which is about this male client that you said was doing really well in all areas except for socially, and you thought maybe he might be high functioning with a potential autism diagnosis, and you said, I don't want to know. Because what if it's not? And that to me really speaks to labels. And labels, I think, have a bad reputation. Sometimes people think that a label is putting something on someone and saying, this is you, these are your capabilities, this is all you will ever be. But labels are also a frame of understanding ourselves, and then they inform the treatment, whether it's going to be psychotherapeutically or with medication. Do you ever have any clients kind of asking you, what's my diagnosis? What's wrong with me? What do I have? Is it this or that? I mean, you said already about people coming in and saying, my husband is a narcissist. I think we all get that all the time. My husband, my wife, I don't know who is a narcissist. But what are people's attitudes and interests in knowing their label?
Yeah, no, I have a lot of clients that they sit down and they want to know, why am I doing this? Or can you explain me why I behave this way? But I always say, this is a process. I need to get to know you, because if he comes with panic attacks or depression, it's easier to diagnose, like the first time. Of course, then we need to gather more information. But yeah, I get that a lot. I always say we need to, I need to know you better, to give you answers.
For me, now that I'm thinking, usually they come with the idea that there is a lot wrong about them.
Okay.
And of course, it's never like that. And I say, I know that we're going to fight, right? In a good way, of course. But there's going to be a fight between me and you. You're going to be your enemy. I'm going to be the one that is trying to say, okay, let's be real here. So to dismantle years and years of sense of not being good enough, of sense of guilt, they really come like, and sometimes they are touched because it's their identity after all. So it's like, okay, I'm not a good person. Why are you gonna tell me that I'm a good person? Why are you telling me that actually I'm not bad? Well, because you're not bad. So we can redefine your identity. Like when we have OCD patients, right? They're like, okay, you're not taking away my OCD. No, I'm not. Don't worry. You know, we just embrace everything, which is true. We are going to embrace, and what I like is when they fall in love about themselves. Pros and cons is like, yeah, this is me. So
Acceptance.
that's, yeah.
So the labeling can be the diagnostic label, and it can also just be elements of their identity that are very deeply entrenched. And what I'm hearing from you is some people really want to know. For them, that's going to be meaningful in one way or another. But also part of the therapeutic process is to challenge people. And I think many people that have not experienced mental health care have this sense that our job is to just sit there and be like, very supportive, very validating, you know, agreeing with everything that people are saying. And importantly, trust, support, emotional validation are critical ingredients to have successful outcomes. But people get challenged, right? We try to challenge them to see things from a different perspective, to motivate insight and behavioral change if indicated.
I think this is the hardest part of the job, right? When we have to slowly, and usually we say something and we repeat it, and one day the client is coming saying that thing, like, you know, I just had an insight. I'm like, oh, that's great. It's good to hear. Like it's something new that I just thought because they have internalized something. So it is a medium, long-term process. It's not something that is happening overnight, of course. But there are layers of years and events. So it's not realistic to think, okay, in a couple of sessions, I'm going to fix you. And I always say that there's nothing that has to be fixed. You know,
I love that.
We just need to discover the beauty.
So one of the things we sort of alluded to but didn't speak about in depth, and maybe this is an opportunity, is that evaluation and assessment process. Because people might start their journey in psychiatry, they might start it in psychotherapy. Maybe you can each sort of tell me a little bit about what's your initial assessment process, where you're gathering the relevant information. What does that look like? What can someone expect if they're coming to see a psychiatrist for the first time and a psychologist?
Yeah, so for me, the first evaluation, I always ask a little bit about their childhood, you know, like how they socialize with the others, how they describe their own, like the personality, important, stressful, vital events in their lives, and then the current situation. I get like a general picture about their personality. I know that 50 minutes maybe is not enough to get to know their whole life, but I get like a summary. And then it's when I decide, okay, you should just do psychotherapy, but if the symptoms are severe, we try medication, and then I always refer to a psychotherapy.
For me, usually when they come, they have something. They have something to bring. They have, their briefcase with something that is ready. And so I start from that to slowly try to understand, where is this coming from? So we can see that, validating everything, every feeling, every thought. But where is this coming from? So it's basically, as you were saying, a challenge, continuously challenging what it seems, what it is. And usually, especially in the long-term therapies, is great the way they learn how to do it. So they come with something and then they're like, and I was, reflecting, and I'm so amazed how brilliant the mind is. Or another tool that for me is absolutely precious are dreams. With dreams, we really can dive, put the diving gear and just go down. And it's a wonderful adventure, actually.
So for you, Lara, you're saying that people present and you gather the relevant information about their current functioning, the historical stuff. You try to figure out what's going on. Sometimes it's about, ruling things in, ruling things out. Maybe I need to stabilize this, and then we can, further assess for this. Should they go and see a psychologist? Should they not see a psychologist? And that's something you can typically do in one session. Sometimes it's a longer, more exhaustive process. Sometimes clients understand that. I think sometimes a little bit less so. And for you, Manuela, it seems that also people come in and they're like, this is what I'm struggling with. And so you want to meet them where they are in terms of that current issue or challenge, but also trying to uncover where is it coming from, and how can we build that therapeutic alliance so that we can rewire your thoughts and your feelings and your reactions and some elements of your identity to work towards that acceptance.
Beautifully summarized.
Yes.
Okay, so we walked through the difference, psychiatry and psychotherapy. Would we say that one is more important than the other? Put you on the spot right now.
These are the two pieces of a beautiful puzzle.
Yeah.
Yeah.
Because I would feel, especially in certain situations, I would feel so alone without a psychiatrist. So alone.
Yeah, me too. I cannot imagine a patient that I do not refer to psychotherapy. It's everything. Yes.
It's two sides of the same coin,
Yes.
right? You work together in such a complementary way, and the care process that you described really just ensures that the client is seen from all of the different angles and supported on that ongoing basis. What is one thing that you wish people would understand or take away from this conversation? Because there's a lot of misperceptions out there about both fields.
Well, I would say give yourself a chance.
Yes, me too, and that we are here to really listen and understand what they are going through and where does it come from. Yes.
It's very individualized care. And I think from like a reception perspective, a lot of times clients make contact with the clinic and they don't know the difference between a psychiatrist and a psychologist. So we educate them as well, similar to the way that you did at the beginning of this conversation. But a lot of times the follow-up question is, well, okay, which one do I need? And it's not a cut and dry answer usually, and correct us if we're wrong. But usually we say, this is what this one does. This is what this one does. Sometimes they work together. Whichever step you feel most comfortable taking, take it. And then that professional will be able to kind of identify if you would benefit from the other person's services and support.
Yes, and guide you how to, next step. Yeah.
Okay. Thank you both for your time. This was a really exciting and informative conversation about the individual support that psychiatrists and psychologists can provide to our clients and the beauty and the magic that comes when you work together.
Thank you,
Thank
Sarah.
you.